Hello, Katie.
Hi, Dr. Elena. We're having
Hi,
a very kind
everyone.
of hi, we're having a fun morning talking about some things, not just about periods, but also about one of my favorite, sex. I love
We're
talking
having a
about
sex
sex.
day.
It's a sex day. Yes, it is. I wish that every woman that I know was in love with the sex life that they had. It's such an important part about being healthy and just being an adult, right? Being an adult. And anyway, there's stereotypes about whatever, like arousal and how long it takes for a man to get ready for sex versus a woman to get ready for sex. And it's not all about candles. I mean, if it was all about candles, I would just be walking around like this all the time, you know? But
Oh, goodness. Yeah, I should get myself some.
I know. I do love
If it
them
was
because I
that
do like
easy,
candles.
right?
There you go. Yep, I know. But it's not that easy. And so, can you talk about what's happening for a woman during the arousal process? If it's normal, if it's not, what kinds of directions can we go in with this?
Yes, absolutely. Arousal and sexual intimacy is a very long discussion. We could probably talk for hours about this, but we never really appreciate what's going on and we take it for granted in our mid 20s
Hmm.
and 30s because our hormones are optimal and it's normal. But we appreciate it when we lose it. When does that happen? Most women experience that in perimenopause. And that
Hmm.
perimenopause time can be maybe 38 to 55. So that's a long period of time, but anywhere in that period of time, women can feel the effects of decreasing hormones.
Hmm.
So sexual intimacy is not just about seeing your significant other and jumping his bones, right? It involves a lot more. It involves psychological, body image, state of the relationship, whether you're happy or not, whether there are things that otherwise put you off about your partner, and it kind of makes it difficult to even initiate a sexual intimacy later on. But certainly the level and optimization of those hormones and neurotransmitters is also very important because all of these are signaling molecules. They're in constant communication with each other. They don't work in their own separate cubicles. Estrogen will talk to progesterone. Progesterone will sensitize estrogen receptors. All of these sex hormones will have an effect on neurotransmitters. So, for example, dopamine will mediate the arousal and desire to continue. But dopamine is also stimulated by estrogen, by especially testosterone. So, in the absence of adequate levels of testosterone, you're not going to have those dopamine levels. Neurotransmitters also, I'm sorry, norepinephrine as a neurotransmitter would also regulate that arousal. So if the norepinephrine is in exceeding or low levels, it's going to have the exact opposite effects than what you might expect with increasing arousal that leads to an intimate moment. Serotonin as a neurotransmitter would also modulate the effects of dopamine and norepinephrine. And I was going to show you here, let me see if I can manage this, that these neurotransmitter pathways are influenced by cofactors. So, what comes in your diet in terms of vitamin B6, iron, very important for women. We had a separate video clip about this, right? Vitamin C, the levels of zinc and copper as they exist together in a ratio, because it's very easy to go overboard on copper. It's easily present
Oh,
in vegetables and fruits. So, if the zinc to copper ratio is not in a 10 to 1 level, copper will displace the effects of the iron. So therefore, we're
what?
not going to
Oh gosh.
have adequate dopamine levels, right, to sustain that kind of arousal or desire to even continue with the intimate moment. Also, um, serotonin will block the effects of nitric oxide in the body. So this is something to also consider, because this can block the low levels of nitric oxide, will block the effects of orgasm. The woman will have a harder time to achieve orgasm. So we need to,
What? Okay,
absolutely. It's not
I
just
hate to interrupt
candles
you
and
ever
roses and
because
chocolates. Please do.
well, because you give such good information, but you just said that there are, I'm going to call it chemical, but it's not the right word. There
Yeah,
are
they are.
chemical reasons why orgasm may be hard for a woman to.
Absolutely.
Oh my
Absolutely.
gosh, that's fascinating.
Chemical slash hormonal neurotransmitter imbalance will also be foundational work for arousal to happen.
Okay, and can I
And
just
nutrition.
say, nutrition, there, the orgasm gap is finally being talked about more, I believe, kind of in popular culture, and for women, which is the expectation that sex is concluded once a man has an orgasm, and whether or not a woman does have an orgasm during is, it might happen, it might not, right? There's an expectation that women will not have as many orgasms as men. And so I think that narrative, just like the narrative we talk about with, well, periods are terrible, menstruation is awful, so accept that having a bad period is normal. Also, we find that it's the narrative of it's so hard for women to orgasm. The temperature of the room has to be right, and the lights have to be right, and the pressure has to be right, blah, 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 blah. And so I've even had this is terrible. I have had friends of mine say that their husbands will not initiate sex with them because it's so hard for them to bring their wife to orgasm. They feel bad and they just want to
Oh,
avoid it.
I'm really sorry to hear that, but my message to them is that um, it's kind of like going back to learning how to bike, right? It's a matter of learning how to keep your equilibrium without having the training wheels. So practice makes it perfect. I think it's more power to them for continuing the exercise and trying to find what is it that stimulates their female partner and how is it that they can pleasure her. Because the same things that may work for him may be a complete turn off for her. But
Yes, and
engaging in open sexual communication between the partners would also enhance their intimate moment.
it's fascinating to me though that chemical changes, hormonal changes can impact orgasm. I've always thought that was simply like surface physiological and also maybe a little bit mental. But to know that, I mean, if you're a woman who's been enjoying a great sex life for a long time, and suddenly you're like, I'm not able to reach orgasm like I used to do. What's going on? You know, like, am I bored? Is there a real problem? Well, knowing that there could be this explanation should give them a lot of hope, because if there's an explanation, then usually there's a solution to go along with it, right?
Absolutely. And there's always a hope. There are lots of aspects involved in arousal and sexual intimacy, and just concentrating on one and ignoring the others is not
Mhm.
making us take strides forward. So it's important to look at everything.
Okay. Well, thank you
Excuse
for
me.
that, for the long aside that I took us down. Let's get
No,
back
no,
to
no.
your
No, no, no,
main
not at
points.
all. This is all
Okay.
useful and it helps the audience have different perspectives. So sorry about that.
That's
What
okay.
I was going to suggest or discuss about is the fact that serotonin will also have negative effects on the nitric oxide levels. And our natural nitric oxide body production decreases with age. So if we don't have oxytocin, there's a lot of technical type of discussion here, and I don't want to get too much into the technical discussion, but I want to emphasize the fact that nutrition matters, because
Mm.
nutrition and absorption of these vitamins and minerals is important. These cofactors are heavily involved in formation of these neurotransmitters, and they have effect on our sex hormones.
Mm.
So for example, if you don't have enough B6, how simple is that, right? Vitamin
Mm.
B6, then you're not able to move glutamate to GABA. GABA is a calming effect. Glutamate is a neuroexcitatory neurotransmitter. So if you have a lot of glutamate, it will make you very anxious, irritable. I can hardly equate that with a romantic situation.
Huh.
When you're anxious, when you're irritable, when you're not able to metabolize your neurotransmitters and it puts you at estrogen dominance, you're hardly inclined to consider any kind of romantic encounter. So all of these neurotransmitters, the balance and the effects of them on the sex hormones and vice versa is very, very important. I mean, even conventional medicine considers and acknowledges that there are 4 different classes of female sexual arousal disorder:
Huh.
hypoactive desire disorder, female arousal disorder, female orgasmic disorder, and sexual pain disorder. And guess what they suggest for the most part as treatment for all of the above? Cognitive behavioral therapy, often with
Uh,
mindfulness focus and
just
consideration.
think your way out of your physical
Yes,
issues.
think your
And
way out of your lack of desire. All right.
that's so demeaning and degrading, and it puts pressure in the wrong places. That makes me nuts.
It is unbelievable, right?
Mhm.
Okay.
It's unbelievable.
So
Well, no, it's not. I
here's
do, but it's insane. It's,
it is insane, and it's
yeah.
mind-blowing that, you would have to think your way out of a situation that is beyond your control.
Yes. Not to
So
mention how that can mess so much with your own ability to know what you do and do not want, right? Like your body's telling you something, but you got to think around that. You're just deceiving yourself. And then are you truly in the moment enjoying it? Ugh.
you're not. You got to have a yoga and meditation session prior to getting in the
Right.
mood, because apparently this is what supposedly it's helping.
The problem. I'm so glad we're having this conversation. I hope that this goes exactly to the right woman who needs to hear this in this exact moment. So, okay, the 4 categories of arousal, modern medicine says cognitive behavioral therapy. And what do you say?
I say that we have to look at everything as a root cause: nutrition, absorption of what is it that you're eating. If there's an impaired absorption, then whatever you're eating, it could be 100% organic. But if you're only absorbing 30% of it, then it's not helping you. Hormone and neurotransmitter balance. And also looking at that adrenal health and resilience, because stress is an important negative factor on your intimate moments.
Hmm.
When you're running away from the tiger, you're not feeling amorous. It's the same exact explanation. When you're anxious, when you're irritable, when you're stressed out that you have an exam due tomorrow, you're not going to feel inclined to have an intimate moment. Relationship status, happiness with your significant other also is an important factor. Body image, also a very important factor. Women who have decreased self-esteem, let's call it that way, maybe not lack, but
Mhm.
decreased self-esteem, is also not going to feel that she is appealing to her significant other. So may refrain from even initiating or responding to any kind of sexual advances, because she probably feels that she will disappoint. So state of mind is also important. Yes,
Mhm.
cognitive behavioral therapy does have a place in the treatment regimen, but it's not the
Mhm.
sole thing. You cannot meditate your way out of lack of arousal, lack of hormone and neurotransmitter balance.
And I think without knowing that this is a potential root cause, women think deeply and constantly. So many might be in the position of overthinking and creating a problem with something where it does not actually exist in order to explain what's going on. So we need to be able to have we need this kind of explanation to get out to the world so that women can know there's nothing wrong with you, nothing wrong with your marriage. You are in love. Maybe those things are not true, but if they all are true and you're still not getting aroused and you're still not able to achieve an orgasm, then what could be happening is this. It's very critical.
It is very critical. A
Mhm.
lot of women, for example, so sorry about that. A lot of women who have hormonal imbalances in perimenopause, they raise this question of not feeling good. They're feeling depressed, they're feeling anxious,
Mm.
and they get put on antidepressives or oral contraceptives, right? That's the most knee-jerk reflex response when they go to the doctor. But both or each individual of these modalities for treatment, I'm putting quotation marks because it's not really a
Mhm.
treatment, it's just masking the
Mm.
symptoms. It's actually putting a damper on your sexual intimacy. Oral contraceptives will block the effects of your androgens. So even the minimal amounts that you may have, it's not going to raise your libido because it's in the toilet. Your oral contraceptives are going to block that effect. It's going to block your ovulation. Not having progesterone on board, it's going to negatively impact your libido, your desire, your even
Oh,
having arousal. And serotonin uptake inhibitors will interfere with that nitric oxide effect. And serotonin, like I said before, it has a very important role in modulating the effects of your dopamine and norepinephrine. And testosterone directly affects your dopamine, your feel-good centers, right? It's your rewarding system. If you don't have that testosterone, nothing to really stimulate that dopamine, you're still lacking, ability to achieve arousal. So there's
my God.
everything very much related. If you know that there is a problem and you get an advice to be on antidepressives and oral contraceptives, please, for your sake, move on. Find someone who will listen to you because that is not the proper response to addressing your
Mhm.
symptoms.
This is a very important video. I feel great that we've created this one. And is there anything else you'd like to add before we wrap up today? Because
Yes.
this is so great. Oh, go ahead.
Yes, I'm sorry.
Okay.
We forgot to mention vaginal lubrication, right?
Oh, yes.
That is a very important aspect in wanting to initiate intercourse, because if the vaginal tissue is friable, is dry, you're not going to be able to sustain intimacy. It's going to be very painful. Dyspareunia, painful intercourse, there is a reason for that. And it's directly linked to imbalance and lower hormone levels. So there is a reason for supplementing those hormones. Estrogen is very well involved in maintenance of that collagen matrix and lubrication of the tissues. DHEA is also very useful for this. And there is Intrarosa, for example. It is covered by the insurance, but it's extremely expensive. I think it's close to $400. But there's compounded DHEA that can be applied topically for less than $30 a month. And it
What?
will lubricate the tissue and improve your sexual intimacy, because being dry, down there, it's not making you feel fabulous. So restore your hormone balance, improve your tissue lubrication in order to be able to have sexual intercourse. There are various
What?
modalities out there, and a lot of women will complain in perimenopause, even not necessarily in menopause, in perimenopause, that they have vaginal dryness, increased painful intercourse. Well, 10 years ago, 5 years, 2 years ago, they didn't have this. Why is that? Because of that hormonal imbalance.
Wow. So then the use of supplementary lubrication, whatever you like to get from the drugstore, um,
It
can you talk
can.
about that? It can help
Yes.
or it doesn't help?
Yes and no, depending on what formulation it is. If it is something that is pro-inflammatory, it may not necessarily be that great. Um, but it's not really affecting the root cause. So lubrication, just for, how should I say? I'm trying to think of analogy. It doesn't come to mind right now. But if you apply a lubricant, it's not really addressing your hormone levels. It's not
Mhm,
addressing that hormone balance. It's just
mhm.
applying something for this particular time that may lead to skin irritation, itching, eczema. You never know. But addressing what's happening behind the curtains, that hormone balance will directly result in these improvements.
Oh.
And there are other therapies. I'm sure that women have heard of O shots, maybe,
Mm.
that are minimally invasive type of injections that are done with PRP, plasma-rich platelet, that stimulate that stem cell rejuvenation in the clitoral and vaginal area, because we women were blessed with a clitoris, let's say it, for self-pleasuring. That is an immense attribute that women additionally have. So that rejuvenation is very important. With hormonal imbalance and weaning, natural weaning of those hormones, stimulation of the clitoris can lead to pain, excoriations, skin tears. So PRP is an adjunct therapy to hormonal therapy to try to intrinsically improve the stem cell production of the collagen and lubrication and plumpness of the tissue in that area.
Wow.
And it improves orgasm, ability to achieve recurrent, and so frequency, as well as intensity of the orgasm. So those are
Wow.
additional adjunct therapies that may be helpful for women.
Okay, can you say the name of it again, and how does a woman go about finding it?
Hmm. I don't want to break the news, but I may be introducing that if I open my practice next year, a brick and mortar. So
Oh,
stay tuned. Shh,
oh
I never
my
said
God.
anything. But there
Okay,
are,
it needs to be called like the orgasm store.
oh goodness, I'm not sure the neighbors will want to have me around, but I understand why. There are certain physicians that are specialized in doing O shots. They have to have special training in this. It's not your OBGYN or, your primary
Mm.
care physician. It involves collection of blood through a venopuncture from the patient, and then collecting the very plasma-rich portion of that plasma. It is pulled in a centrifuge, so it's a little bit of an involved procedure.
Wow.
But for the patient, it's minimally invasive. Obviously, any kind of injection in the clitoris, it's going to hurt and it's going to be extremely
Oh,
sensitive.
whoa, the shot goes in the clitoris.
Oh, it is.
Oh
So
my gosh. I thought that was like in
there
the
is a
shoulder. I'm
local.
like, sign me up.
Oh,
What?
goodness, no. It does involve a local anesthetic, but it's well tolerated by women with excellent results. So it is something to consider as an adjunct
Wow.
therapy, not necessarily the first go-to treatment, because still at baseline, hormonal balance needs to exist. Lubrication of that tissue needs to be done with appropriate hormone balance.
So it isn't the first step. Maybe there's
Those
a
are the
second.
first steps, absolutely. All people will go for non-invasive before they consider minimally invasive. But just so people
Wow.
know, and I'm sure that many women in our audience, they're probably familiar or maybe have heard of O shots, but have not really investigated that further.
I've, let me tell you, I love sex. I love orgasms. I've never heard of O shots. So I've learned something very, very new today.
Coming soon to you at your local
Oh
community. Stay
man,
tuned.
we wouldn't get anything done in my house, I swear.
That's not a bad thing. If everything comes as a close second, I second that.
Oh my gosh, my poor husband. All right, well, what a fascinating video. I can't wait for people to read this or listen to this and see this and learn quite a bit about how much brighter the colors they see every day can be.
Absolutely. And it improves the mood and it improves the relationship status as well. And the more sex you have, ladies, the more it improves your natural production of endogenous testosterone. So, what a better reason to improve your endogenous production of testosterone, right?
Fantastic. Marvelous. Okay, well, thank you so much, Doc. I appreciate it.
Thank you,
Um,
Katie. Please leave us your comments if you have any
yes.
questions, concerns, issues,
And you
any
can
kind
send
of
anonymous
criticism.
emails, send private
Anonymous too.
emails to us. We won't post them if you want us to. We'll answer your questions. We are going to get women to have a better sex lives in addition to everything else we're doing for them.
It's overdue, right?
Great. Well, thank you very much, Doctor. This was great.
Thank you, Katie. See you in the next
Bye.
episode.
Bye.